So our final speaker today is Dr. Alex Clarke-Cornwell, and she's going to be discussing, is there a sedentary behaviour paradox?
So I'm going to talk to you today about some results from one of my PhD studies. So I'm going to start by talking about a pandemic, but not the COVID pandemic, but the obesity pandemic. So we know that over the last 30 to 40 years, we've seen this rise in prevalence rates for obesity across all different countries over the world. However, we have also seen an increase in the number of adults who are taking part in moderate to vigorous intensity physical activity. So these results here are from the Health Survey for England. Then also in England as well, the Institute of Fiscal Studies, they carried out a study a few years ago about looking at the number of calories that people are purchasing. So not just through the weekly shop, but also from alcohol purchased or anything through restaurant meals out, etc. as well. And this decrease in the calories purchased was seen across all different types of households. So there's some sort of energy actually imbalance going on between the calories consumed from food and the calories burned during physical activity that may be leading to this obesity pandemic. And it's not quite clear what are the reasons. So there's three hypotheses that authors have talked about in the literature. So the one I'm going to talk today is about sedentary behaviour. So there seems to be a decrease in our light activity over the past 30 to 40 years and an increase in sedentary behaviour. Two of the other reasons that may have caused the obesity pandemic are to do with the amount of sleep that we're having. We're now sleeping less, and also the types of food. So we're having more processed foods and things than we did 30 to 40 years ago. I'm just going to concentrate on the sedentary behaviour aspect today. So because of the technological revolution, we've increased our sedentary behaviour mainly through labour-saving devices in the home, from our transport, we're using the car more often, and then particularly in occupations, a number of occupations who would have had that sort of those higher levels of light physical activity have now been replaced by sort of more sedentary occupations with the increased use of computers and desk-based workers. And then also in manufacturing, the use of robots and machinery to replace those jobs that would have included that physical activity aspect. So in all the research that's looked at sedentary behaviour, and we know that increases in sedentary behaviour are associated with a number of health-related outcomes. And these include obesity, heart disease, cardiometabolic risk factors, some cancers, type 2 diabetes, and premature mortality. And a lot of the research has found that these associations are independent of our physical activity levels. And for those of us who are economically active, the majority of our sedentary time is accrued within the workplace or working at home as we are now. However, there's limited research that has examined the role that occupational sedentary time contributes to these health associations. So associations of sitting time and health may function differently, and that depends on the domain in which the sitting is measured. So using self-reported sitting time, the authors of this study found that there were high levels of television viewing, that they were associated with unfavourable health outcomes for all biomarkers. Although these were mediated by BMI, they remained significant on the whole. However, these same associations were not seen when occupational sitting time was measured. So one of the aims of one of the studies within my PhD was to investigate the associations between objectively measured occupational sedentary behaviour and health-related outcomes. And this was a secondary analysis using data from the Health Survey for England, which in 2008 asked a subsample of participants to wear the artigraph accelerometer for 7 days to measure their physical behaviour. So there were 2,356 adults with accelerometer data, and 911 of these were in full-time employment. So one of the first analyses that I carried out was a hierarchical, quantile regression analysis to look at the effects of occupational sitting time on BMI. So I did this using a range of models, and I just wanted to show you the results from Model 3 and Model 4 today. So Model 3 adjusted for age, gender, accelerometer wear time, lifestyle variables, and other health status variables. And then I'll go on to look at Model 4 once I adjusted for moderate to vigorous physical activity. So in Model 3, there was a significant association between increased levels of occupational sitting time, and these were associated with higher levels of BMI. However, in Model 4, after adjusting for moderate to vigorous physical activity, these associations became non-significant, and it was actually moderate to vigorous physical activity that was a significant predictor of BMI, so the high levels of physical activity and the lower levels or the lower values of BMI. I also then went out to carry out a series of linear regression analyses looking at occupational sedentary time on the different cardiometabolic markers. And I found that occupational sedentary time was not associated with other cardiometabolic markers or other heart conditions or self-reported heart conditions. However, BMI was significantly associated with 3 of the cardiometabolic biomarkers. You can see here total cholesterol, HDL cholesterol, and glycated hemoglobin. I also carried out another different type of analysis called a sequence analysis. So this was carried out on the full-time workers, and it was able to analyse the pattern of physical behaviours across the day within different groups. So this diagram here is called a state distribution graph for 3 occupational classifications, and it shows the different patterns of how physical behaviour activities were accrued across the day. So for example, all the time points, if you look at the top left chart, there's a greater proportion of managerial and professional workers who were engaged in sedentary behaviour compared to the intermediate and the routine manual occupations. So this can be seen by the large amount of the blue area on that graph. So sequence analysis can also be used to carry out something called an optimal matching and hierarchical cluster analysis. So this type of analysis is used to create a typology of the physical behaviours of the full-time workers. So the analyses identified 3 clusters that were grouped based on a dissimilarity measure. So across the clusters, there was a clear reduction in the mean length of sedentary behaviour bouts from cluster 1 across to cluster 3. And furthermore, there was an increase in the length of the light physical activity bouts, again from cluster 1 to cluster 3. So further profile analysis of these clusters that differs significantly for occupational classifications, with a higher proportion of people in professional occupations seen in cluster 1. And they also, the people in cluster 1 had more favourable health outcomes compared to the other 2 clusters. So from the results from the different analyses within this study, I created the following pathway. So the first thing to look at was that sedentary behaviour was associated with BMI. However, after adjusting for physical activity, occupational sitting time was no longer associated with BMI. And it was in fact that physical activity became the main predictor of BMI. And we also know that BMI is a predictor for a number of health related outcomes. And from the sequence analysis, and also sort of following on from what Andreas was talking about before, about this reciprocity between physical activity and sedentary behaviour across the day, the pattern in which we accumulate these behaviours differs by occupational category and may also have an important impact on health related outcomes. So therefore, if the relationship between sedentary behaviour and physical activity is important to health, and we know that BMI is a mediating variable between physical behaviours and health related outcomes, then this proposed pathway may help to design studies that can model this. But I suppose it's also important to note the influence that sleep and diet has on both physical behaviours and BMI. So what we don't know yet is how we can sort of disentangle all these behaviours with respect to health-related outcomes. So to conclude, we know that previous studies have found associations with total sedentary time and leisure time sedentary behaviour with different health-related outcomes. However, when we objectively derive occupational sedentary time, there's no association with these same cardiometabolic markers. So what's next? To try and develop methods to take into account the complex interactions between these physical and lifestyle behaviours and health, and maybe sort of using some of these different analysis techniques such as sequence analysis and compositional analysis may help to do that. So I just want to say thank you for listening, and I just want to point out the two of their societies here. So we've got the International Society for the Measurement of Physical Behaviour, and also ProPass Consortium as well, which you can follow on Twitter. So that was also something that Andreas mentioned before as well. Okay, thank you very much for listening.
Thanks very much for that presentation, Alex. That was really interesting. So quickly to ask you a quick question, because we're overrunning slightly. Just to go back to the title of your presentation. So do you think there is actually a sedentary behaviour paradox?
I think there may be, and it may be that there is a sedentary behaviour paradox for maybe office workers or those desk-based workers. So I know Andrea sort of mentioned this morning about the physical activity paradox. So that found that in those blue-collar workers, even though they were meeting their physical activity guidelines by the physical activity they accumulate at work, they were still at increased risk of health outcomes. And I think in a similar way for those office workers, for those sort of more white-collar workers, that the sedentary behaviour they accrue at work may not have a significant impact on their health, especially if they do enough physical activity to negate that. So that's what we don't know, and that's why the ProPass and the Surpass projects are really important for really looking at every, how those different domains in which we accrue physical behaviours and that pattern across the day of how we can sort of try and unpick these really sort of multifaceted interactions.
Thanks very much. And just leading on that question, then, what do you think the answer is to this paradox? Should we try and encourage people to accumulate more physical activity in their leisure time, or is the answer trying to encourage physical activity during occupation time?
Well, some of the evidence that's coming out now is about breaking up that sedentary time in office workers. So we're just coming to the end of an NIHR study looking at occupational sedentary time with a behaviour change intervention with and without a standing desk. So sort of watch this space, because that's being written up at the moment. So those the report and the paper should be finished by February next year. So I can't give away any secrets yet, but hopefully that will help inform some of this, especially for office workers. But I think the key message in the literature at the moment is to try and break up that sedentary time throughout the day. And there are some studies that have looked at those breaks in terms of diabetic outcomes and things, and have found changes if you do break up that activity or break up the sedentary time, even with just standing up and short bouts of walking around for a minute or so every hour.
Brilliant, thanks very much. That's really interesting. I can sort of justify my bodged home standing desk now.
I've got my real one here. Look, it makes a noise. Like I change.
Brilliant. Right, well, that brings us to the end of the session. I'd just like to thank all the presenters. I think we were very lucky. We have had a very interesting morning, and thanks everyone for attending.